When a fever spikes high and the torment of days blends into restless nights, the shadow of typhoid might just be creeping closer than one might think. In the bustling streets of cities and the tranquility of rural dwellings alike, this ancient adversary of human health lurks unforgiving and indiscriminate. With over 11 million cases annually across the globe, typhoid fever remains not just a medical issue, but a pressing call to re-examine our strategies in public health and hygiene practices. This biological menace, caused by, manifests a saga of suffering, from subtle onset to potentially lethal complications, painting a poignant picture of why vigilant defense is our paramount weapon. Typhoid fever, primarily caused by the bacterium, traces a route of transmission that is as simple as it is preventable. It spreads through contaminated food and water. This pathogen thrives in environments lacking adequate sanitation, finding its way into the human body through the ingestion of just a small number of bacteria. Once inside, it is not the presence of the bacteria alone that causes disease, but their invasive action into the intestinal walls and subsequent spread to the bloodstream and other organs. The life cycle of is a true testament to its resilience. After overcoming the gastric acid barrier of the stomach, these bacteria embed themselves in the small intestine. Here, they multiply and invade further, eventually reaching the lymphatic system and bloodstream. This systemic spread is what leads to the characteristic high fevers, severe abdominal pain, and profound weakness associated with typhoid. The disease's progression is stealthy. Initial symptoms are often nonspecific, including fever, headache, and stomach pains, which makes early diagnosis challenging. As the bacteria colonize the body, they wreak havoc on the immune system, leading to a debilitating battle between the invading pathogen and the body's defenses. While many may recover with appropriate treatment, typhoid fever harbors the potential for severe and life-threatening complications if left unchecked. Among the most dire of these is intestinal perforation, a condition where the walls of the intestines are breached. This leads to the leaking of intestinal contents into the abdominal cavity, a scenario that demands urgent surgical intervention due to the risk of widespread infection or peritonitis. Another critical complication is typhoid psychosis, which occurs in a small percentage of cases. This neurological manifestation can result in delirium, hallucinations, and aggressive behavior, complicating the clinical picture and treatment regimen. Such severe complications underscore the deceptive nature of the disease. What begins as a manageable infection can spiral into a critical condition that encompasses multiple organ systems. Cardiac complications, though rarer, include myocarditis and endocarditis. Both conditions involve the inflammation of heart structures, leading to significant morbidity. The diversity of these complications not only reflects the systemic nature of typhoid fever, but also highlights the necessity for timely and appropriate medical intervention. The line of defense: diagnosis and prevention. Early diagnosis is paramount in managing typhoid fever effectively. Blood, stool, and urine cultures remain the gold standards for confirming infection. Recent advances in diagnostic techniques have seen the development of rapid diagnostic tests that can detect the presence of the bacteria within hours, offering a crucial tool in early detection. Prevention, however, is the cornerstone of battling typhoid fever. It hinges on improving sanitation and access to clean water, pillars that are unfortunately still lacking in many parts of the world. Vaccination plays a critical role, especially in endemic areas. Current vaccines offer significant protection and are recommended for both residents and travelers to high-risk areas. Educational campaigns that emphasize the importance of hand hygiene, safe food preparation, and the avoidance of untreated water are crucial. Such initiatives not only reduce the incidence of typhoid fever, but also bolster the overall health of the community by preventing other waterborne diseases. In conclusion, typhoid fever, often overlooked in the shadow of other global health threats, presents a formidable challenge to public health. Understanding its causative pathogen, recognizing the potential severe complications, and implementing robust diagnostic and preventive measures can turn the tide against this persistent foe. As we advance, let the narrative of typhoid not be one of despair, but a testament to the power of informed, collective action in overcoming biological adversities.